It is wonderful to look out and see so many of you who have worked with us, not only in this effort, but have been so committed to this field for so many years. People that have been working and toiling and striving and doing incredible work long before I ever joined the Board of Supervisors, and will continue to do it long after I'm gone. And I want to recognize and acknowledge that. We talk a lot about changing the societal stigma. We talk about providing a better way to deliver behavioral health care, and none of that in any way is a reflection on any shortcoming of anyone who's involved in this work today. The people that are involved in this work today have been ahead of the curve in recognizing what needs to happen. The change that needs to happen at the policymaker level. It needs to happen at the level where people are making decisions about where we fund, staff, site, reimburse, and commit our efforts to that. And so I want to commend each and every one of you who give your entire life and your heart and soul to helping those who are in need, and give a round of applause to all of you. We are incredibly grateful for all the work you've been doing and appreciate your partnership as we move forward. So thank you all very, very much. I want to acknowledge my incredible colleague, Supervisor Lawson Reamer, who's here today, who has really added so much to our board, a level of expertise, commitment, and drive, someone who has a great interest in issues of behavioral health, and has just really been a tremendous add to our Board of Supervisors. 3 years ago when I joined the board, I made a commitment that we have to address a lot of things. There are a lot of issues that come before you in the position that you face, and you have to deal with all of those things, but you also need to have a focus and a prioritization. Coming out of the legislature many years ago, I came to the realization that too many elected officials try to do too many things of very little significance or depth, and that perhaps we'd be better served if we would identify a few priority areas and focus on them and try to make significant progress. And as a candidate for the Board of Supervisors, I said issues of behavioral health would be my highest priority. And we built our time and our calendar and our schedule and our staff around driving and implementing those types of things. And in the last 3 years, we have seen the county do more than they have ever done before. Significant increases in investment and prioritization and focus. But we're not here today to resuscitate all the things that have been done. We're here today, I think, to not just receive a report, but we're here today to mark a moment in San Diego. And that moment is really rooted in two things. One, the ongoing acknowledgement that no one entity alone can address this issue. This issue is much bigger and more complex than just county government. County government's got to do more, significantly more. State government's got to do more, but the reality is issues of behavioral health are so intertwined across our community that it takes everyone in this room committing to saying we're all going to be a part of continuing to drive solutions. And when we talk about these issues of behavioral health workforce, it requires each and every one of us, and whatever organization or entity that you are a part of, to have that same level of commitment moving forward. But the second thing that I think is very significant is we've successfully, I think, moved the discussion away from when I was elected to a singular focus on how many locked inpatient psych beds do we need, to an acknowledgement that the need for those is a damning indictment of our failure to hold people at lower level of acuity. And now we're living in the space about community care and care coordination and those types of things. But the second shift that I think today, hopefully in my mind, signifies is a shift that moves us away from talking about programs, buildings, and beds, and one that incorporates talking about people. Because a program does not help anybody. A program by itself is a name, has a reimbursement stream, but that program is only as effective as the workers who are involved in treating people. A building by itself, nobody's life was ever made better because there was a nice new building to go to. That building is just walls. It is the people who work in that building. It is the individuals who provide care and compassion and expertise. A bed by itself might give you somewhere to sleep, but it's not going to make you better. It is the staff who help the individuals who are in that bed. And I think that today is a deep acknowledgement that we have a long way to go as a region. and making sure that we are investing in the people who provide this care. And there are so many incredible things that are coming out of this report. And when we outlined it, I was very clear at the outset. I'm not interested in your typical commission steering committee report that says, here's the problem, and then the recommendation says, tell nonprofits to work with universities to come up with creative solutions. That doesn't help anybody. I mean, that doesn't help anybody. Then you have an event just like this and you celebrate it and then nothing happens. We wanted specific recommendations, and you have them, 92 pages of them. Exactly how many workers we need in each classification, from peer support specialist to psychiatrist. How many do we need? And then specific recommendations on how you uniquely fill each of those roles. How do we get you the supervised hours you need? How do we get you the internships you need? How do we create a pipeline and training? How do we tell someone who can't go 2 years without working to feed their kids that you should get this certificate and get this program? These are all of the things that are baked into this report. How do we pay you better? The simple reality is, what was so stunning when you listen to the workers and you read this, is how much people deeply love the work that they do. Some of the hardest work you can imagine, and how much they deeply love what they do. But the simple reality that someone who's trained to provide care and love and compassion and potentially turning a life around cannot be paid less than someone who works at Chick-fil-A. They can't. We got to pay them. We have to retain them. We have to make sure they're not experiencing burnout. We have to support them. We have to open up pipelines for achievement. And we have to really think about doing things differently than we've ever done before. And that is why we're here today. I would say nowhere in America has built out the system of behavioral health care to provide the right care to the right person at the right time. And I want San Diego to be the first. Nowhere in America has done a report of this level, with this granularity, with this specific recommendations. And I want us to not be the first ones to do the report. I want us to be the first ones to implement the recommendations and finding. And so the work today that we focus on is, how do we build out the behavioral health workforce we need so we can achieve a simple goal? And that goal is back to what I said earlier: the right person can get the right care at the right time. And that is not just the unsheltered individual who's on the street. That is every one of our kids, that we break the cycle of taking our kids to get a physical. We take them to get a wellness check. We embrace what may be their early struggles, and we provide them help and care. And we do that across the continuum so that we get to a place where it is no different if you are diabetic than if you suffer from depression. But in order to do that, we have a long way to go. And so I am so grateful and appreciative of all of the work that has been done. As chair of the Board of Supervisors and member of the Board of Supervisors, I am fully committed to doing our part. One of the recommendations is very specific to the county. We got to lift the administrative burden on folks. We have to lift the administrative burden to free our workers up to be able to do the work. There will always be accountability, but we've got to change. Something that was put in place 10 or 20 years ago, it doesn't make any sense today. So the county, we're going to do our part. I'm going to continue to do my part, pushing the state, convening, leading, and moving. But the reality is, it is going to take each and every single one of us, and we're going to talk today a lot about the implementation plan and the reality that do not leave this room without signing up to be a part of the group of folks that are going to come together regularly to talk about what we're doing to implement, to assign tasks out to various groups, to lobby, to advocate, to push, because all of the work that we've done to get to the point today will be a tremendous disservice if we just let it sit here. Today is the beginning of our process. The issuance of the report is not the end of the process. It is merely the beginning. And so we have to move forward. Before I wrap up, I'd like to ask each of the members of the steering committee to please stand and recognize an incredible amount of work over the course of a year plus. If you were a part of the steering committee, please stand. We appreciate you. And to Andy and Peter and team at the beginning, I outlined really what we wanted out of this, and you all delivered exactly what we needed. not because it's what I wanted, because it's what our region needs in order to do it. And in closing, I'll just say, when I started and said, we'll make this a priority, everyone said, you can't, it's too complicated, it's convoluted, it's all of these types of things. And you know, there's a great line that you can be an idealist without illusion. I believe that we can build a better way to deliver behavioral health care. I believe we can help everyone from children in our schools, to kids in juvenile hall, to those that are in our correctional facilities, to the homeless and unsheltered, to people that have experienced trauma, but I am under no illusion that it is easy. And so I ask you to join us. Outside the wall of my office, we have a sign that says, we only do hard things. We only do hard things. Other people get elected, they can do easy things. We don't want to do easy things, we want to do hard things. Because the hard things are the ones that will have the most impact. And so I ask you to join with us today in this effort to implement the findings of this report and be willing to get uncomfortable, to roll up your sleeves, and to really help us all push together. And if we all come together, we can see significant progress, and the people that benefit will have a significant improvement in their lives. So thank you all. I look forward to being here the entire day with you and appreciate all of the work to help get us to this point. Thank you all.